For decades, families across the UK have sought to prove that a drug called Primodos caused their deformities. It was prescribed as a pregnancy test in the 1960s and 70s, until this warning appeared on the packet in 1975 that it shouldn't be used by pregnant women. The drug stopped being sold in 1978, but manufacturers said evidence that it caused malformations was inconclusive. But now one of the UK's leading professors of evidence-based medicine, Carl Hennigan, says by collating the data from previous studies, his team at Oxford University has found a link.
What the evidence showed across all of them studies is, the first thing is to say the direction of effect was showing that there was an association with congenital malformations. But when we actually then synthesized them into the meta-analysis, the evidence was clearer for this association. And it was a clear association for all congenital malformations, but also more specific malformations, cardiac malformations, musculoskeletal, neurological and urogenital malformations. It was all clear there is an association there that is significant.
This comes almost exactly a year on from a report by regulators, the MHRA, that said a strong link couldn't be found. Sky News discovered inconsistencies and omissions in this report. For example, this forest graph had been removed. Anything above the line points towards an association between the drug and malformations. 8 of the 12 most significant human studies did just that. Carl Hennigan scientifically pooled the data from these studies to create an even more reliable reading. The diamond shape is the correlation of everything, and it sits firmly above the line.
What's gone clearly wrong here is complete failure to do the right approach to systematic review. You ask a clear question, you find all the evidence, appraise the quality and summarise it. That was missing in the EWG's report.
In a statement, the MHRA said their report was robust and independent, that this publication does not contain new data. It is a different approach to the analysis of the existing historical observational data which was reviewed. In line with our commitment to review any new evidence, we will be consulting independent scientific experts for their views. But here's another revelation about the drug, and it comes from a former employee of the manufacturer Schering. Sandra Malcolm worked as a receptionist and had missed her period. She went to see one of the company doctors to see if she could get a test with Primodos.
He said, "I can't give it to you because it may not work and it may cause deformities."
So this was a Schering doctor?
Yes.
Saying to you this drug could deform a child if you're pregnant?
Yes.
And you just thought, OK, I'll stay away from that drug then?
Yes. And I just assumed it wasn't on the market. It couldn't possibly be on the market.
This was 1971, the same year over 200,000 women in the UK used Primodos. It would be another 7 years before it was removed from the market. Schering is now owned by German pharmaceutical giant Bayer, who say that, based on available data, scientific evidence does not support an association between Primodos and malformations. Jason Farrell, Sky News.